Existing in the middle of the lush and prosperous Sundanese area, which is rich of various culture, and natural magnificence. Becoming milestone in educating the nation, building persons to be society servants and nation founders. Universitas Pajajaran, or UNPAD, was born due to the initiation of West Java leaders and government support to establish a higher education institution with various disciplines. Launched by President Sukarno on September 11, 1957, today, UNPAD has a large number of institutional achievements. Such as status improvement as the incorporated higher education with A accreditation. This achievement is in line with the commitment of all policymakers in order to accomplish the vision and mission of UNPAD to be excellent university in conducting a world-class education that is able to support the nation's competitiveness through a quality learning process and innovative research. The representative learning facilities and strategic campus in the center of Bandung City, Bandung Regency, and higher education zone in Jatinangor, Sumedang, make UNPAD as an excellent university in conducting education, research, and community services. Through its best programs enabling to fulfill the needs of society. Nowadays, UNPAD has 16 faculties and 1 postgraduate school, totally consisting of 152 study programs. Faculty of Law, Faculty of Economics and Business, Faculty of Medicine, Faculty of Mathematics and Natural Science, Faculty of Agriculture, Faculty of Dentistry, Faculty of Social and Political Sciences, Faculty of Arts, Faculty of Psychology, Faculty of Animal Husbandry, Faculty of Communication, Faculty of Nursing, Faculty of Fishery and Marine, Faculty of Agricultural Industry Engineering, Faculty of Pharmacy, Faculty of Geological Engineering, Postgraduate School. Realizing the importance of learning process, curriculum and learning method are continuously developed in order to adjust the dynamics of stakeholders' needs. Nowadays, UNPAD has used student-centered learning method. That is, learning method focuses on students as the base to actively involve in developing knowledge, skills, attitude and behavior with competence-based curriculum. Supported with professional faculty members and staffs, Unpad is capable of generating competitive and characterizing graduates. Until now, it has registered 10,000 of students from all over Indonesia and hundreds of international students studying in Universitas Padjadjaran. To optimize the education and learning processes, Unpad is supported with various representative supporting facilities such as library, Basic Science Service Center, Language Center, e-learning, teaching hospital, and dental hospital. In addition, Unpad is also equipped with student dormitory, health facility, sport facility, campus transportation, banking, hall, and entrepreneurship facility. Such various facilities are supported with the utilizing of information technology. Besides supporting the academics quality, Universitas Padjadjaran also fully supports the activity of student character building through some student unit. As a part of society, Universitas Padjadjaran absolutely realizes that its function is limited not only in teaching, but also social and cultural aspects. Some social activities, society empowering, and research implementation have been conducted to give real benefits for all society. Universitas Padjadjaran, straightening and developing together with society. From West Java, for Indonesia, to the world through SDGs.
Greetings from Transcendence 2021, massive open online course in Cleft and Palette held by Faculty of Dentistry Universitas Padjadjaran in collaboration with Smile Train and Indonesian Cleft Center. My name is Rashid Abdulaziz, a dental student from Faculty of Dentistry Universitas Padjadjaran as the master ceremony of today's live discussion. Good afternoon from Indonesia, and I would like to greet everyone here. Good morning, good afternoon, and good evening to everyone. Today is our 31st live discussion, which means we have reached the end of week 8 live discussion, which is the final week of our course. It's been a terrific experience for all of us to be successfully made this far with all of the help of your excitements and all of the amazing speakers for providing their best learning materials. So we had discussed almost every aspect that we need to know about cleft lip and palate, from the introduction, the embryology, the pathophysiology, the treatment, the social aspect, and many more. The one that we will discuss today is another interesting topic that oftenly discussed among everyone. It is the telemedicine. Telemedicine is a rapidly growing aspect in the healthcare, especially in this pandemic. Not only our events are strongly affected by this condition, that we have to switch the platform into a virtual course, the healthcare system is also adapted to this condition in order to provide flexible and comprehensive care to the patients. And then today we will discuss about the telemedicine in Cleft Care with Dr. Singh as our speaker. Dr. Subodh Singh is the Director and Chief of Plastic Surgery from GS Memorial Plastic Surgery Hospital, India. Hello, Dr. Singh.
Hello. Namaste from India, and greeting to all participants, students and teachers from this wonderful university. And Rashid told you all, I'm Dr. Subodh Singh, and I'm a plastic surgeon and also director of GS Memorial Plastic Surgery Hospital. And I've been the president of Indian Society of Cleft Palate and Craniofacial Anomalies. And I shall be very, very happy to answer any questions, queries, or any subsequent questions that you might have on telemedicine in Cleft Care.
Thank you so much, Dr. Singh. It's been an honor for us to have you again, and we are so excited to have you again today. Thank you so much, Doctor. And then we also have Dr. Erli Sarilita as our moderator. She is one of the lecturers from Faculty of Dentistry Universitas Padjadjaran, and she is also the person in charge who coordinate this course. Hello, Dr. Erli.
Hello, Rashid. Hello, Dr. Singh, and hello, everyone.
Okay, Doctor. So I would like to explain a short description about today's live discussion. Maybe you all already know, but this live discussion will be separated into two sessions. In the first session, Dr. Singh will be answering the question that has been filled out by the participants on our website, and then the student committees will help us to provide the question in the screen. And then in the second session, the live discussion, the participant will have the opportunity to ask directly to Dr. Singh through the comment section or by opening their microphone and video. And then the recorded version of this live discussion will be posted on our website, so the other participants that can make it into today's live discussion can watch it later. And now I would like to give the spotlight to Dr. Erli as our moderator and Dr. Singh as our speaker. Dr. Erli, you can start the live discussion. Thank you so much.
Thank you, Rashid. Dr. Singh, how are you?
I'm good, Erli, and we can right away start with the question answer sessions. I'm eagerly waiting for the questions from the participants. Yeah.
Yes. First question, please, committee. First question, committee. Yes, from Shiva Biandra, Universitas Padjadjaran. Telemedicine usually is needed in rural area, but how to reduce the probability that most people in rural areas cannot access or does not have awareness about the feature? Doctor?
Yes. So as if you've seen the presentation, you would have seen the evolution of telemedicine services that we had in our center. So I wanted to start telemedicine right from the year 2000 when it was nascent and it was just beginning. But initially by 2003-04, the telemedicine equipment were very, very expensive. And they were just a technology demonstrators. So big institutions could have it, but it was never put to the actual patient treatment use. So it was a technology demonstrator where big institutions were using it and they were communicating with another institution only. So it was never in a public use. But now, after 2010 and 2013, so the internet became widely available. And then the smartphone also came. So now we have internet technologies available on a smartphone. We have 4G and even now 5G technology available. So the coverage of internet, which was the major restrictions for rural area, is now there. It has spread still in the rural areas as well. So all the remote areas are also connected, especially in India. All the areas are connected with the internet, high-speed internet communication. And people have become aware of use of so many different apps. They've already started using apps. They've already started using the transactions online, using different apps and Google Pay and other methods. So now this is the right time when we can use the technology for the poor people and people who are living in rural areas and in remote areas. But of course, in the places where the internet is not available, this will still remain a limitation. So
Yeah.
awareness has to be given. This has to be a continuous process. So at every contact with the patient and their families, the awareness have to be raised. So that is a process that we have to continue, I think, for next 1 decade before everybody becomes aware of it and starts using it naturally.
Okay, thank you, Doctor. We still have some new question, please, committee. Okay, from Faras, is the outcome of speech therapy through telemedicine is more or less effective than face-to-face speech therapy? And what are your future innovations to improve telemedicine?
So as I mentioned in my presentation, the entire process of telemedicine in Cleft Care was started by us for providing speech therapy. And unfortunately, that still remains an area where we have to do a lot of innovation and a lot of efforts. So, but the good thing is people have now started taking speech therapy sessions on telemedicines. So we will have, I will not be able to give you an answer whether it is less effective or more effective because we do not yet have a comparative study on that. We do not have sufficient data and we have not analyzed the 2 different kinds of speech therapy. But one thing that I can tell you is now more and more people are receptive for speech therapy through telemedicine. So once the patients are not coming for face-to-face speech therapy, even if it is more effective, it is not useful because they're just not coming. But if they're coming more frequently on telemedicine, right? So even if as such, it may not be as effective as face-to-face, ultimately, it will prove to be more effective and more beneficial because they have been taking a regular speech therapy sessions on telemedicine. So I'm very hopeful and I'm very positive that the speech therapy through telemedicine will make a defining change in the cleft palate patients as far as the speech is concerned. And this is something that we should adopt and promote it. We will have to work very hard to promote it and to make people use it, and I'm very sure that it will be much more effective than face-to-face therapy because people may not be able to use face-to-face speech therapy on a frequent basis. And as far as the future is concerned, so we are planning a group speech therapy for a group of patients who have similar speech defects. So we are trying to identify patients who may have one or the other kind of speech defects. So we will take a group sessions for those. We are recording their speech samples, and then we are working out on their speech sample, and then we are going back to them and rectifying those speech defects. So we are also trying to work out if we can assess the nasality. And if we can assess the nasality on those patients, and that might mean a velopharyngeal incompetence, then we will call those patients to our hospital and investigate them with nasometry or nasoendoscopy or cineradiography. So different methods. And we will also assess in future how good was our assessment of nasality through telemedicine. So all these patients who are primarily screened for nasality can be further worked up at the hospital setup. And if there is a future surgery required for correction of VPI, then we will do that.
Agreed, Doctor. Thank you for your answer. So, to measure the effectiveness, of course, we need more research. However, telemedicine is far better than not coming to the treatment itself.
Yes.
So it's, of course, it's an answer, especially in this pandemic situation. Okay, so next question from Hasna, Universitas Pajajaran. Does the outcome of telemedicine effectiveness equivalent to the income used in early day? Is there any plan to improve telemedicine anytime soon? And do you have any suggestion for developing countries that are just starting to use telemedicine?
So I would start from the last question first. So for all the developing countries, my suggestion is jump on it right away. Start it today, right? So that you can identify the problems that you are facing and then you can rectify. So it is important to start early because you will have a learning curve. Your patients will have a learning curve. You will have your own problems with your own society, with your own system, and you will take some time to rectify them before you mature and you standardize your technique of telemedicine. So start it right away. So to improve telemedicine is to now we have a very high speed internet connection. So we not only able to schedule it, we have online software as well. So that will help in scheduling the sessions with the patients. So not only for speech therapy, but for other consultations as well. So the scheduling and real telemedicine sessions will be easier with the use of dedicated online cloud-based software. So that should be used. And if an institution has a dedicated telemedicine system, it's fine. Otherwise, there's so many other platforms available which are free that can be used to begin with. And first question, does the outcome of telemedicine effectiveness, etc., is equivalent to income used in early days? I do not understand this question. So what is the meaning of equivalent to the income used in early day?
Yes, I don't understand it as well, perhaps. Maybe we can skip that question.
No, but if I have to answer that question, if it means if it is cost effective, then of course it is very, very cost effective. It is much more.
Okay, and then the next question from Maulida. Does telemedicine can be used only for speech therapy, or is there other cleft treatment that can be done through telemedicine?
Oh yes, a lot of things can be done. We are doing it for diagnosis and initial consultation with the surgeon, and even orthodontist is seeing patients for the changes and progress in their treatment. And our nutritionist is also giving counseling on telemedicine. So all that happens on telemedicine. So now the patients come to the hospital only for surgery or some particular kind of treatment, if it is an orthodontic treatment or something, some intervention only. So rest, all visits are mostly on telemedicine only. So everything can be done on telemedicine, not just the speech therapy.
That's interesting, doctor. So you mentioned about cost effectiveness. So of course, we have patients that came from a low economic background that will be very helpful, so they can save their time so that they can work and get their child for treatment as well. I think it's important in Indonesia for us to start this telemedicine right away, as you said. Okay, Maulida, you still have question? Yes, from the participant, I think it's from the Zoom participants. From Nur Hadi Kusuma, how are your country law and regulation regarding telemedicine? And what about medical malpractice law regarding misdiagnosis, which can be happen in telemedicine?
That's a very interesting and important question, and we should all understand the limitations of telemedicine, right? So now our country brought a guideline on 25th March 2020. That was the first guideline. So a law has still not come. So a guideline has come, so of a detailed guideline, and I can send it over to you. And as far as the medical malpractice law are concerned, so all medical malpractice law, which is applicable to other kinds of practice in medicine, are also applicable in the telemedicine practice. So you need to be careful. You can't do all the treatment by telemedicine. Telemedicine has its own limitation. At the same time, courts also understand the limitation of telemedicine, and the patient should also understand that the limitations of telemedicine. You should explain the patients what are the limitations. There should be a disclaimer, and help of a local practitioner should be sought if you are expecting there are some other problems. Fortunately, in Cleft, there's not big problem in diagnosis. You can easily diagnose unless the patient has a cardiac condition or a cerebral condition. So if you're suspecting that, you can ask them to show to a local pediatrician or a cardiologist. So otherwise, it is the safest practice as far as the Clefts are concerned, because the diagnosis is right in front of you. You can see everything through telemedicine and diagnose, and you can seek the help of a local pediatrician for further evaluation. So, but the all malpractice law are applicable, and the courts are also aware of the limitations. So you should not worry about it, and but take all safeguards while treating patients through telemedicine.
Okay, thank you, Doctor. I think that's the last question from the audience, but I still have the follow-up question. Doctor, in Indonesia, we still haven't applied the telemedicine in Cleft Care. And do you have suggestion for the centers who would like to start telemedicine in Cleft Care? What requirements that they have to prepare, human resources in IT perhaps, or telemedicine platform that you have suggestion which? Please, Doctor.
Yeah, so starting telemedicine is easy. You can use Microsoft Teams, Google Meet, or Zoom, Skype, whatever to start with. You can use any of these methods to do a telemedicine. But you can also have an app-based telemedicine. For example, we are now using an app that we have developed and launched for the entire country. Anybody can use it. It's called eCure app. So we are using, so it has a provision of scheduling, listing the doctors, departments, hospital, everything can be done, and we can certainly share it with you. So you can do that, and patients can just find out the schedule of particular doctor. If they want to show me, they can search my hospital, search me or my speech therapist or my nutritionist, and see the slots which are open, and they can just book it, right? So by paying the whatever fee that you might have, right? So you may have it without fee or a limited fee or a full fee, whatever that you can decide. And then at appointed time, you both go in a waiting room and start communication, right? So all that communication is even recorded, and you get all the data of all the communication that you did with the patient on different dates, all the medical records that they upload, everything will be available, right? So if you want to go for an advanced type of technology, use an app-based or web-based technology. If you want to start right now and see how it goes, the available technology, right, can be used from today. You don't need to wait it, right? So you can use, if you have a center-based telemedicine like we have 12 centers in across 4 states. So if you have a distant center in a distant hospital in a distant city, right? So one person may man with one laptop and a good internet connection, right? So, and all the patients can come there and they can show to the consultant sitting in your hospital. So that can happen. So we started with the center-based telemedicine. So we opened up centers because at that time, patient did not have a smartphone. The patients were not aware how to use the technology. So we started center-based. So I have a center 600 kilometers away or 800 kilometers away. So the patient need not travel to our hospital. They travel 30, 40, 50 kilometers and go to that center. and show it to us and go back to their home, right? So, but now the technology is available that they can do it from their home. But you need a person who will coordinate this so that the consultant's time is best utilized. So if they have booked it and they're not coming online, so you should have at least a person who can coordinate that. So I will be very happy to coordinate with somebody at your hospital to get this started at your place. And there are several methods, and cost is not at all a problem. So you don't need a huge infrastructure to start with, but you can develop it to any extent.
That's great, Dr. Singh. Yeah, it's really nice that to hear that you're willing to share with us your experience. So, Doctor, what's your strategies in, let's say, the marketing of the telemedicine option to the patient? How do you get them to use it?
Now, so as soon as we come to know about the patient, when they contact us by telephone or by email or by the hospital visits, we let them know about our telemedicine center as well as our telemedicine app. So we are also publicizing it through our social media campaigns. We also put it in newspapers and FM radios. So we're utilizing all soft methods of publicity. And then patients, they have a word of mouth publicity as well. So we are publicizing it, and people are very receptive. So at all places we have that we are now on, like EQ app. So now patients are getting to know about it. So we have worked it for last 7 years. So a lot of patients are already aware, but more and more patients are joining to this. And we have the database of the patients, so we send them SMS messages or WhatsApp messages. So, so we utilize all those methods of publicity and let the patients know about it.
So I assume the participation of the patient through this telemedicine will start low, but then significantly getting higher.
So the beginning will be slow, and then there will be a steep rise. So and it will be good for you also, because then you will get used to it. So any center which it is starting, it will have less number of patients in the beginning. So they will understand all the intricacies of telemedicine. They will master it, and by that time that inflow will increase. Now we have at least one patient, more than 400 patients come to us for surgery that have been primarily seen in a telemedicine center only. So the first contact has been through telemedicine. So we get more than one patient every day for surgery. So this number is slowly increasing.
That's right. So it's really nice to hear that, Dr. Singh. So I would like to check to the committee. Do you still have more questions? Or that's all? Perhaps I would like to ask Dr. Singh to give a message to our Cleft centers in Indonesia who hasn't started the telemedicine. Maybe you have a few words about it, Dr. Singh?
Sure. So the telemedicine is the technology for developing countries like ours. And with the use of telemedicine, we can take the medicine to the places it has never been. So, and much more frequently than the center-based medical care can ever reach. So it's important to start early. It's easy. It is not difficult at all. You can start it today. So it's easy. Please start telemedicine as soon as it is possible. Don't be afraid of medical legal suits and laws, because they're all favorable and they can easily be managed, and it is extremely beneficial for the patients, and something which is beneficial for the patients and the society is good for the country and is good for you. So adopt this technology as soon as it is possible so that you mature and learn the intricacies of it. And I'm there to support you, support Indonesia in any way possible. Anything required, we can provide you the ready-made solutions for telemedicine for any university, any hospital, or any number of universities or hospitals. So, or any suggestion if you want, I will always be available to help you.
Dr. Singh, thank you very much for a really nice session today. We learned a lot, and of course, we will share the recorded session to our Cleft Center so that they can hear your message, Doctor. And to visit Bandung Cleft Center.
Thank you. I would love to visit the center and the country as well.
Okay, thank you, Doctor. So I will give the session back to Rashid.
Thank you so much, Dr. Erli. Thank you so much, Dr. Singh. Maybe before we end today's live discussion, since this is our last live discussion, so I would like to ask you, how do you feel about this kind of events? Do you have any recommendation or anything to all of us, especially about this event?
I think this is a great idea, and this was for the first time that I saw that such a huge plan was made, and the speakers were chosen from all over the world, and such a good record of all the talks were kept, and I hope this is available to everybody in the world, and they can access this, and students and teachers can access these talks whenever they want. This was an extremely good idea, and more such programs should be brought in. So I really appreciate it.
Thank you so much, Dr. Singh. I hope when the condition is better, maybe in the next event, you will come to Indonesia and be with us again.
I would love to.
Thank you. Thank you so much.
Thank you very much, Rashid and Erli and all the participants. Thank you.
Thank you. On behalf of the student committees, I would like to thank all of the participants for being a big part of this event. It's been a wonderful experience for all of us, and I'm personally grateful to get to see everyone who is passionate about cleft lip and palate here. And I believe that the future of medicine is within us. And thank you for all of the experts. Thank you, Dr. Singh, who are willing to share the insightful and valuable information to all of us. Okay, maybe we have reached the end of today's live discussion. Maybe we can take a picture first with all of the participants. To all of the participants, please turn on your camera so we could take a picture together. Okay, maybe we would start. I will count. 1, 2, 3. Once again, 1, 2, 3. Once again, 1, 2, 3. Okay. Thank you so much once again, Dr. Singh. Thank you so much, Dr. Erli, and thank you so much to all of the participants. See you on the next events and stay healthy.
Thank you.
Thank you, everyone.